Hello students. Here I'm reaching you with recorded videos for better understanding of the topic. So today I want to discuss with you about pharmacology of anti-cancer drugs. So this is very important topics for exam point of view. So please concentrate on this topic. So first, before going to anti-cancer drugs, we will discuss something related to cancer. Okay. So generally everybody knows about cancer. So what is the definition of cancer? Cancer is nothing but, so there is a progressive, persistent, purposeless, uncontrolled proliferation of the cell is called as a cancer. Again I will repeat the definition. So it is defined as progressive, persistent, purposeless, uncontrolled proliferation of a tissue or a cell is called as cancer. Okay, the cancer is also known as neoplasm. It is a synonym of the cancer. So neoplasm is means new growth. So generally any abnormal mass of tissue, any abnormal growth of mass of tissue is called as tumor. Abnormal growth of mass of tissue is called as a tumor. Actually not all tumors are cancerous. Okay, so some are cancerous in nature, some are not cancerous in nature. So whatever the tumors are non-cancerous is called as benign tumors. Whatever the tumors which are cancerous, they are called as malignant cancers. Okay, so malignant cancers only they are dangerous, so they require therapy. Okay, which type of therapy? So it includes, one is surgery. So you have to remove the lump, cancer lump, cancer tissue with help of surgery. Second one is radiotherapy. Third one is chemotherapy. Chemotherapy means with help of eradication of cancer cells. Okay, eradication of cancer cells with the help of any drugs is called as a chemotherapy of cancer. Okay, but what about benign tumors? Benign tumors not necessarily need any drugs or any radiotherapy. Generally it requires surgery. Sometimes it is a problematic, so the benign tumors are removed by the surgery. Okay, so that's it. So first, what are the characteristics of the malignant tumors? Okay, malignant tumors characteristics, very very important. So first characteristic is they are exhibit uncontrolled proliferations. Okay, uncontrolled proliferation. So second one is they have the property of invasiveness. They have the property of invasiveness. Invasive is nothing but, so they are penetrated into, okay, adjacent tissue is called as a invasiveness. Okay, so third important differentiation characteristics is they have the property of metastasis. What is metastasis? They are migrated from, okay, its origin. Some of the cancer tissue, cancer cells, they are migrated from the primary origin to, okay, other organs, okay, via circulation, blood circulation or lymphatic circulation. They are deposit in the other parts of the body. They produce secondary cancer. Okay, for example, okay, one person suffering from lung cancer. Okay, the lung tissue, cancerous lung tissue, they are detached from the primary lung tumor. It is migrated from the, okay, from other than its origin. Okay, migrated to other parts. It cause secondary cancers either in any part. Okay, so maybe either cause ovarian cancer, maybe so liver cancer, so like this. Okay, so that is called as a metastasis. Okay, so next is they don't they are not differentiated well, not differentiated, are nothing but de-differentiation. Okay, is nothing but de-differentiation means they are not differentiated from immature cell to mature cells. Okay, so de-differentiation. Okay, so next is there is a loss of function. Okay, non-functional. So these are the very important characteristics of the cancer cells. So what is the characteristics? Okay, uncontrolled proliferations. Second one is invasiveness. Third one is metastasis. Next, lack of differentiation or maybe de-differentiation. Fourth one is the Next one is the loss of functions, not functional. Okay, so these are the characteristics of the malignants. Okay, so how these benign tumors are separated from the malignant tumors? Okay, so benign tumors are they exhibit self limited growth. They exhibit self limited growth. Okay, they are not have the property of do not have the property of invasiveness, and also they do not have the property of metastasis. Okay, so one more thing is they are restricted to its original location. They are not migrated, they are restricted to its original location. One more thing is they are well covered by one capsule. They are well capsulated, but malignant tumors are not capsulated. Okay, so benign tumors are they have well boundary. Okay, you can clearly differentiate the boundaries of the benign tumors, but malignant tumors are they do not have the boundary. Okay, so they do not have the boundaries. Okay, next is benign tumors are rarely lethal. Okay, so majority of the time benign tumors are not dangerous. So very sometimes it is they are lethal whenever they suppress constrict the blood vessels. Okay, so in such cases there is a decrease in blood supply. In such case we can remove the benign tumors. But any cancer, okay, malignant cancers, all malignant cancers are lethal in nature. So this is the differentiation between the malignant tumors and as well as the benign tumors. Okay, so next slide. um, Next is coming to anti-cancer drugs. Okay, so you can see the chemotherapy of any bacterial infections, any antibiotic, okay, or any antimicrobial agents, okay, which is going to be inhibit the growth, okay, or kill the microorganisms, okay, without or little effect on the host cells. Okay, we are designing like that. Okay, so we are designing like that. Okay, so any antibiotic which is going to be toxic, which is going to be lethal to the microorganism, but is less or no lethal to the healthy cells. Okay, because this most of the antibiotics which mainly target the various biochemical pathways, or maybe either farm target taken place only in the, okay, so bacteria or maybe either protozoa or fungi, okay, which is not taken place in the our host cells, so that they are highly toxic to the such parasites. Okay, but when it comes to the anti-cancer drugs, okay, so there is no well there is no well qualitative differentiation, okay, between the cancer cells and as well as the cells regarding the targets. Okay, regarding the targets, okay, definitely in order to treat the cancer, you can target the you can stop the proliferation of the cancer cells. Okay, so the proliferation mechanism in cancer cells and as normal cells is the same. So there is no specific qualitatively differential target between the cancer cells and as well as the normal cells, so that so majority of the anti-cancer drug, they stop the proliferation of the, okay, so fastly dividing cells. Okay, fastly dividing cells means highly proliferating cells are highly affected by anti-cancer drugs rather than the slowly proliferating cells or the cells which are in the inactive form. Okay, so that majority of the anti-cancer drugs, okay, which produce toxic effect to the healthy cells by stopping the proliferation. In order to stop the proliferation, the drug need to be acting on the, okay, so macromolecules like DNA and RNA. So the DNA RNA is the same in cancer and as well as the normal cells. Okay, so that they stop the proliferation by acting on the DNA or RNA of the normal sorry, in the cancer cells and as well as in the healthy cells, so that they are highly toxic. Okay, so that's why majority of the anti-cancer drugs are cytotoxic in nature. They have the property of cytotoxic. That's why they comes under cytotoxic drugs. Okay, so next, okay, so in these cytotoxic drugs, okay, so that's why majority of the anti-cancer drugs are highly toxic. Okay, so side effects is more with anti-cancer drug. That is the reason is, this is the reason. Okay, so cytotoxic drugs again classified into so many drugs, so many subcategories. First is alkylating agents, second one is antimetabolites, third one is anti-cancer antibiotic. So next is a plant derived anti-cancer drugs. Okay, these are all the cytotoxic drugs. So next means cytotoxic drugs, they remove the cancer cells. Okay, so by killing them, okay, they killing the cancer cells. Okay, so next hormones. Okay, generally hormones, they don't produce cytotoxic effect. So this they only stop the growth of tumor, the growth of cancer cells. Okay, they won't exhibit the anti-cancer activity. Sorry, they do not produce cytotoxic activity, only they have the stop the growth of the tumor cells. Okay, so next is certain enzymes like L-asparginase. Okay, so these are the broad classification of anti-cancer drugs. Okay, next if you see this slide, okay, you can see the how the nucleic acid synthesis taken place. Okay, any nucleic acids like RNA, DNA start from the synthesis of its nitrogen bases. Okay, so nitrogen bases are purine nitrogen bases or pyrimidine nitrogen bases, they are synthesized. Later on they converted into nucleosides. So nucleosides to nucleotide they are incorporated into the, okay, they're the they are involved in the synthesis of nucleic acids such as RNA, DNA. So thus the DNA replication will stop so that the cell will proliferate it. Okay, so majority of the anti-cancer drug, okay, is going to be stop the replication of the DNA. Okay, stop replication of DNA, or sometimes directly acting DNA. Okay, so by acting on different phases of nucleic acid synthesis. Okay, so first is here, if you first step, okay, if you see the first step here, so there is a purines and pyrimidine nucleotides are purine and pyrimidine nitrogen bases are there. So these nitrogen bases converted to nucleotide. Okay, that is called as a ribonucleotide. That is going to be affected by some drugs like 6-mercapturine and 6-thioguanine. Later on, the ribonucleotides, some ribonucleotides are generally involved in the synthesis of RNA. Okay, in order to involve in the DNA, they convert it into deoxyribose sugar. Okay, what is the sugar present in the ribonucleotides, they convert it into deoxy sugar, so that deoxyribose nucleotide form. Okay, so they are building block, actually they are involved in the synthesis of DNA. Okay, so conversion of ribonucleotides from one form to other form is going to be affected, inhibited by methotrexate. Okay, methotrexate and 5-fluorouracil. Okay, next once this deoxyribonucleotide synthesize, okay, so they are incorporated into the DNA structure. Okay, so newly formed structure with help of DNA polymerase. Okay, that is going to be inhibited by, okay, so cytarabine. Okay, so next is DNA. Okay, so farm DNA. So some drugs directly acting on the farm DNA. Okay, rather than the processing of synthesis of DNA, some drugs directly acting on the farm, okay, DNA. Example, majority of the anti-cancer antibiotic like bleomycin, doxorubicin and daunorubicin. Okay, so next is majority of the alkylating agents. So generally they're directly acting on the farm DNA, so that which stop the DNA functions. Okay, so stop the DNA function in the sense, stop the replication of the DNA to DNA, and as well as the synthesis of RNA. So which leads to inhibit the transcription process, translation, as well as the DNA replication, which all result into stop the cell proliferations. Okay, so this is about the brief summary of the, okay, majority anti-cancer drugs. Okay, so first next slide, it is a description about the cell cycle. Okay, so next thing is cell cycle. Okay, so any cell, not only cancer cells and also healthy cells, undergo proliferation by uh, by uh, by so reaching to, okay, means coming from one phase to other phase. Normally any cell, okay, proliferating cells, maybe cancer cells and normal healthy cells, so it is undergo various phases. Okay, that is called a cell cycle. Okay, when any one cell is once completed, one cycle is completed, so that the cell is divided into two, like that. Okay, so the cell cycle, the cell cycle majorly consists of two phases. One is a M phase, that is called as a mitosis phase. One is interphase. So interphase again divided into different phases. So if you see the diagram, you came to know the different phases. So that is called as a G0. G stands for gap. G0 phase is nothing but is a resting phase where the cells, normal healthy cells, they are in the resting phase. So whenever there is no need for the proliferation, so the cells will be there in the G0. Whenever the proliferation is necessary, the cells will be migrated from one phase to other phase. Majority of these cells, so they either partially or completely lost the ability to proliferate. During G0, some cells permanently they are lost the ability to replicate further. So when come from the germination cells during life period, starting from life period, so they will be well differentiated. But second, any damage taken place to certain tissue, they won't undergo cell cycle. So definitely it is a problematic. Examples like nerve tissue or maybe cardiac tissue. Any etiological factor which damage to the nerve cells, nerve tissue and the cardiac cell, so they permanently damage, they won't be regenerated because they don't have the ability to continue the proliferation cycle. In such cases there is a permanent damage, so that you need to some there is no treatment. You need replacement of that cell. So replacement in the sense, suppose heart replacement, in case of severe myocardial infarctions. So next, but rather than the nerve tissue and as well as the heart tissue, remain majority of these tissues are in the G0 phase. Next, whenever necessary, the cell goes from G0 to G1 phase. G1 stands for gap 1. So the gap 1 means the gap between G0 and as well as the S phase. So the gap between the G0 and as well as the S phase, this is called as a G1 phase. Where the cell is preparing some enzymes or proteins required for the S phase, that is called as a G1 phase. Next, coming to S phase, where the cell synthesize DNA replication of DNA taken place in S phase. Here the nucleic the DNA is going to be synthesized into new DNA. Replication of DNA taken place in the S phase. So next is the G2 phase. So in G2 phase, there is nothing but gap 2, that the phase in between S phase and M phase is called as G2, where again the cell is preparing for the next phase, that is called as a mitosis cell division. So where it will synthesize some proteins, some enzymes required for mitosis. So M phase, where actually the cell is equally divided into two halves. The cell is equally divided into two halves. Mitosis phase. So once mitosis is completed, so the cell is completed one life cycle, cell cycle, so that the resulting daughter cells, so they are undergo maturation process, differentiation process. After completion of differentiation, they are converted into mature cells. Then they go to the G0. If they want still further, so again they continue the one more cell cycles. So what is the difference between the cell cycle in cancer cells and as well as the healthy cells? So in healthy cells, so every steps, there is a some regulators. That regulator will stop the cell cycle. So that they control the cell cycle. Whenever there is a need, there is a they allow the cell move to one phase to other phase. But in cancer cells, due to a lack of control, so over the cell cycle phases, so the cell is continuously continuously run one phase to other, so that there is a rapid proliferation, uncontrolled proliferation taken place. So that is the major difference. So by knowing this cell cycle, what exactly you got from the cell cycle is, you know the better understanding of the site of action of the anti-cancer drugs, site of action of anti-cancer drugs. So anti-cancer drugs are broadly, they're classified into cell cycle specific, cell cycle non-specific drugs. Cell cycle specific, cell cycle non-specific. What is meant by cell cycle specific? So these are highly active. They stop the proliferation of cancer cells by acting on the specific phase. That may be either G1, that may be either S, or maybe G2 or M phase. But the cell cycle non-specific anti-cancer drug, so they are stop the proliferation by affecting on all the phases. It will affect the cell at any stages of the cell phase. That is called as a cell cycle non-specific. So that cell cycle non-specific drugs, they are highly effective on rapidly proliferating cancers and slowly proliferating cancers. Slowly growth and fastly growth cells. So cell cycle non-specific anti-cancer drugs, so they are effective on slowly growth cancer cells, and as well as the fastly dividing cancer cells. But so cell cycle specific drugs, they are highly effective. They are highly effective only on rapidly proliferating cells. Because rapidly proliferating cells, they undergo some phases of cell cycle, so that they are highly effective on rapidly proliferating cancer cells, but limited effect or no effect on the quiescent cells or maybe non-dividing cells. These are the differentiation between the some anti-cancer drugs. What are the drugs comes under the cell cycle non-specific drugs? Cell cycle non-specific drugs, so major alkylating agents. Major alkylating agents. Next, anti-cancer antibiotic, some anti-cancer antibiotic, like actinomycin D and mitomycin. So next is cell cycle specific. So Wink alkaloids and taxanes, they mainly stop the mitosis cell division, especially metaphase. So they are effective, they are called as cell cycle specific, so they are specific for the effect on metaphase. So next is bleomycin. So generally bleomycin is, again, it is anti-cancer antibiotic. It is effective on G2 phase. They block G2 phase. So next is S phase. Majority antimetabolites like folic acid antimetabolite, purine antimetabolite, pyrimidine antimetabolite, and topoisomerase 2 enzyme inhibitors. Later on I will discuss you what are the drugs comes under topoisomerase 2 enzyme inhibitors. They are effective on S phase, means they stop the replication of the DNA. So this is about the some anti-cancer activity of the cancer regarding to the cell cycle. So next, this is about something. Next is toxicity of anti-cancer drugs. So this is very important. So toxicity, generally toxicity is associated with anti-cancer is unavoidable. So research is research is going on to how to combat the toxicity associated with anti-cancer drug, either by using novel drug delivery system, or maybe so they're combining with other drugs which reverse the toxicity of anti-cancer drugs. So broadly, toxicity of the anti-cancer drugs are classified into two types. One is a general toxicity, second one is a specific toxicity. So these are the general toxicity. Mostly it is common for a majority of the anti-cancer drugs. General toxicity. So in that, first very most important toxicity is bone marrow suppression. So already I told you, so majority of the anti-cancer drugs, they are highly effective on rapidly proliferating cells. So not only in the cancer cells, and also rapidly proliferating cells taken place in our body. Major sites which involve rapid proliferating cycle is, one is so mucosal layer of the intestine, throat. okay, throat. Okay, so mucosal layer of the throat and in the gastrointestinal tract. Second one is hair cells. Okay, hair cells. So third one is the cells in the bone marrow. So next is the cells in the gonads, so female gonad and male gonad, sperms and as well as the worm. Okay, so that's why majority of the entities produce highly toxic to these sites. Okay, GAT, okay, bone marrow, hair cells. Okay, so next is gonads. Okay, so that bone marrow, first is bone marrow suppression. So okay, bone marrow suppression nothing but they stop the replication of the cells in the bone marrow, so that they produce bone marrow suppression. Okay, which leads to decrease in all the cell count in the blood. Okay, okay, RBC, WBC and platelets. Okay, so decrease in RBC is called as a, definitely it is anemia. So the person is suffering from anemia. So because of the bone marrow suppression, whatever the anemia it comes is called as aplastic anemia. Aplastic anemia. Okay, so second one is leukopenia, so decrease in WBC counts. Okay, decrease in WBC counts, prone for the patient to getting of so many opportunistic opportunistic infections such as, okay, fungi, example candida albicans. Okay, viral infections, viral infection, herpes simplex viral infections. Okay, cytomegalovirus infections. Okay, so third one is protozoal infections. Okay, protozoal is okay, so protozoa antimybial stolate amoebiasis. So next is bacterial infections, especially mycobacterium tuberculosis and mycobacterium avium complex, a typical mycobacteria and typical mycobacteria they cause tuberculosis. Okay, so these are called as opportunistic infections. Okay, okay, so next is platelets. Okay, decrease in platelet count, definitely there is a decrease in coagulative mechanism, so it causes bleeding. Okay, so these are the manifestation resulting from the bone marrow suppression. What are the manifestations? One is anemia, aplastic anemia. Second one is leukopenia, which result into getting of so many opportunistic infections. Third one is bleeding. Okay, next, second one is immunosuppression. Okay, immunosuppression is nothing but, okay, this anti-cancer drug, they also acting on the lymphatic tissue, so that they stop the proliferation of the T lymphocytes. Okay, so they stop both cellular immunity and as well as humoral immunity. So that because of the immunosuppression, so already I told you. Okay, so the patient is have the chances of getting so many opportunistic infections. Okay, so opportunistic infection, okay, mainly resulting from both bone marrow suppression and as well as the immunosuppression. Decrease in proliferation of T lymphocytes in the lymphatic tissues or lymphatic tissue. Okay, so that's why some anti-cancer drug, because of the immunosuppressive characteristic, okay, they also used as a immunosuppressive agent. Okay, immunosuppressive agent for treating of organ transplantation rejection, and some other autoimmune disorders. Okay, because of its immunosuppressive property, some anti-cancer drugs also used in other than the cancer. Example, okay, so to prevent organ transplantation rejection and autoimmune disorders like rheumatoid arthritis, okay, lupus erythematosus syndrome. Okay, so like that. Okay, next is GAT. Okay, already I told you the lumen of the GAT. If you have the epithelial tissue, is a layer of epithelial tissue. This epithelial layer continuously shed off and regenerated. Okay, so this process is going to be inhibited by anti-cancer drugs. So generally it causes, okay, ulcers. Okay, formation of ulcers in the mouth, formation of ulcers in the GAT. Okay, in severe cases the ulcer causes bleeding. Okay, GA bleeding. Okay, GA bleeding. Okay, gastric ulcer and mouth ulcers. Later on, very important is, okay, majority of the anti-cancer drugs are potent nauseatic agent. Okay, they produce nausea and vomiting. They produce nausea and vomiting due to two effects. Okay, central mediated actions. Okay, central mediated action is nothing but they stimulate the central nervous system. Okay, they especially stimulate the CDZ, chemoreceptor trigger zone. Okay, so these anti-cancer drugs stimulate the CDZ, so that they cause nausea, vomiting, association of nausea, vomiting. Later on, because of the cell destruction, okay, they damage the histamine containing and as well as the serotonin containing cells in the intestine or in the stomach, okay, wall, okay, so they immediately release a number of mediators involved in the vomiting, like histamine and serotonin. This serotonin send the signals, okay, to the vomiting center via efferent sensory signals from the J80 to, okay, CTZ stimulated later on it stimulate the vomiting center, so it causes nausea and vomiting. Okay, so nausea vomiting is because of central action and peripheral actions. Okay, central action by directly activating of CTZ, okay, peripheral action due to, okay, release of, okay, emetic molecules, okay, in the enteric nervous system, okay, like histamine and serotonin. The serotonin send the emetic impulses from intestine to CTZ. Okay, next is the toxicity related to skin and hair. Okay, toxicity related to skin and hair. Okay, so majority related to hair, so they mainly damage the, okay, hair follicle, so that it causes loss of hair, that is called as alopecia. Okay, generally majority of the anti-cancer drugs, they have the property of producing alopecia. So when come to pertaining to skin, so they cause dermatitis. Okay, dermatitis. Okay. Okay, next is gonads. Okay, so when it comes to the gonads, female gonad and male gonad. Okay, female gonad is ovary, male gonad is nothing but testis. Okay, so what are the main function of testis and ovary is, testis function is to produce sperms. Okay, so ovary is mainly produce ovum. Okay, so in such gonads also there is a continuous cell proliferation taken place, so that anti-cancer drugs stop the, okay, stop the production of both sperms and as well as the worm. It leads to the toxicity resulting of toxicity on gonads, two effects. Okay, in case of males, there is a decrease in sperm count, that is called as a oligozoospermia. Okay, so next is the second one is impotency. Okay, impotency is nothing but infertility. Okay, infertility because of decrease in sperm count. Okay, but in case of, okay, females, so there is a menstrual irregularities. Okay, menstrual irregularities and as well as infertility is common both men and as well as the women. Okay, next, coming to fetus. Okay, suppose if pregnant women, okay, if use, okay, anti-cancer drugs. Okay, so this majority of the anti-cancer drugs is teratogenic in nature. Okay, so they cause the abnormalities, okay, in the fetus, because the fetus also, it is a growing tissue. Okay, so it is a growing thing. Okay, so that it will damage the growth of the, it is affect the growth of the fetus. It results into either abnormalities in the fetus after birth. Okay, is going to be produced physical abnormalities, okay, or mental abnormalities. Okay, second one is sometime it will cause abortion. Okay, sometime it causes death, fetal death. So these are the three manifestations resulting from usage of anti-cancer drugs during pregnancy. Okay, so example, what are the toxicity you can see during pregnancy is, one is teratogenic effect, so second one is abortion, so third one is fetal death. Okay, next, what are the toxicity related to children's, children's, growing children's, mostly affected by this. Okay, anti-cancer drugs, so the retardation of growth. Okay, retardation of growth can you seen in the children's, those who are receiving anti-cancer drugs. Okay, wound. Okay, generally wound also have some proliferative tissue. Okay, so delay in wound healing generally you can observe. Okay, so while anti-cancer therapy. Okay, delay in wound healing. Next, hyperuricemia. Okay, hyperuricemia, in the sense, majority of the anti-cancer drugs have cytotoxic, so that rapid destruction of the nucleic acids like RNA, DNA, it releases to purinucleotides. That purinucleotides undergo metabolism into uric acid with the help of xanthine oxidase. Okay, that uric acid, it causes hyperuricemia. Hyperuricemia causes gouty arthritis, and as well as, okay, so kidney stones. Okay, kidney stones, this is the manifestation resulting from the hyperuricemia. Next, carcinogenicity. already these mainly acting on the DNA nucleic acid, so that they cause mutations in the gene, mutations in the gene, so they have the ability to cause secondary cancers, secondary cancers, that is carcinogenicity. This is about the general toxicities associated with uses of anti-cancer drugs. Next, specific toxicity. okay specific toxicity specific toxicity means some anti-cancer drugs not only produce general toxins already we discussed, along with they produce specific toxicity particular to the specific drugs. So example. So cyclophosphamide is a alkylating agent. Generally it is a prodrug. It converted into active mustard, and as well as one metabolic byproduct that is called as acrolein. The acrolein accumulation in the urinary bladder, accumulation of acrolein in urinary bladder, they cause inflammation of the urinary bladder. It leads to bleeding. That's why it's called as a hemorrhagic cystis. Cyst is nothing but uh, uh, it is a bag. So urinary bladder inflammation, cytis means inflammation, so they cause hemorrhagic cystis. Because of accumulation of toxic metabolite of cyclophosphamide, that is acrolein. Accumulation of acrolein in the urinary bladder, it causes hemorrhagic cystis. So next, methotrexate and vinblastine. Vinblastine, methotrexate, they are potent myelosuppressive drug. Myelosuppression is nothing but bone marrow suppression. Myelosuppression is nothing but bone marrow suppression. So especially they cause megaloblastic anemia. So next is cisplatin. It is very nephrotoxicity, is a nephrotoxic agent, or means it damages the kidney. Next, vincristine and paclitaxel, they generally cause peripheral neuropathy. Bleomycin is an anti-cancer antibiotic. It causes toxicity related to lungs. Pulmonary fibrosis. Next, doxorubicin. Anthracyclic antibiotic. Doxorubicin comes under anthracyclic antibiotic. Generally they cause cardiotoxicity. Next is 5-fluorouracil. 5-fluorouracil, it causes toxicity related to skin of hand and foot. That is called as a hand foot syndrome. So this is called as a hand foot syndrome associated with uses of 5-fluorouracil. This toxicity is very very important. Please keep in mind. There may be chances of asking questions regarding the general, what are the toxicities to the anti-cancer drugs. So this picture will show you what are the different toxicity. Please go to the diagram later on. So these are the specific toxicity. So methotrexate, stomatitis nothing but toxicity. It causes ulcers in the angular part of the mouth. So bleomycin, so pulmonary toxicity. Doxorubicin, cardiac toxicity. Cisplatin, nephrotoxicity as well as the water toxicity. So the symbol will give you the toxicity. Here is C. C. So it is related to ear, kidney shape. So that you can easily remember the toxicity. Ototoxicity, nephrotoxicity. Cyclophosphamide, it is called as so accumulation in the bladder cause hemorrhagic cystis. Vincristine, vinblastine, peripheral neuropathy. So this is a general toxicity. This picture will represent the specific toxicity. So now I am closing the class. So next class, next time I will come with one more video. So in that video you will completely discuss about individual anti-cancer drugs. Thank you very much. Thank you.